Tennessee. Shelby County, shown in blue, shows a significant increase beginning in mid-December and remains much higher than in the other metro counties. As a reminder, Shelby County Health Department has mandated and a federal judge has upheld a mask requirement for all schools covered by the Americans with Disabilities Act. Parents whose children attend those schools who have concerns that the children are not masking as required may call the health department's hotline 901-222-MASK or 6275, and our school support team will investigate and make recommendations to school authorities. Next slide. This graph shows vaccinations by vaccination date with first, second, and third doses shown in differing shades of blue. In the past 7 days, 8,739 vaccinations have been given in Shelby County, which is an increase since last week. An average of 1,248 vaccinations were given each day in Shelby County over the past 7 days. Next slide. Here, you see the breakdown of the vaccinated population by age. 58.7% of Shelby County's overall population has received at least one dose of vaccine, and the percent fully vaccinated, having completed the series of 2 doses or more, is 50.5% of the population. The age 65 to 74 population is the most heavily vaccinated, with 79.8% fully vaccinated, and 26.8% of children aged 5 to 17 are now fully vaccinated. And we are proud to report today that 70.1% of the overall population age 18 and older has now received at least one dose of vaccine. That is an important milestone set last year by President Biden. 60.7% of the 18 and older population is now fully vaccinated, having completed the series of at least 2 doses. Next slide. Last year, the COVID-19 Joint Task Force set a goal of vaccinating 70% of the entire population of Shelby County, and we are now closing in on that goal. More than 472,822 residents are now fully vaccinated, representing 50.5% of the total population, and 58.7% of the total population has received at least one dose of vaccine. We are making progress to reach this goal. This is the end of the slides. The health department will offer first, second, and booster dose Pfizer vaccines to anyone age 5 and older this Saturday on a walk-in basis at the Cooper Young Farmers Market at 1000 Cooper Street in the parking lot of First Congregational Church. Children age 18 and younger must be accompanied by a parent or legal guardian with proof of the child's age. Birth certificate or the child's shot record is accepted. Please also bring CDC vaccination card or a vaccination record to receive second or booster doses. And the health department's immunization clinic is offering COVID-19 vaccines to anyone age 5 and older, including booster doses for anyone 12 and older. Hours are 8 a.m. to 4:30 p.m. Monday through Friday. No appointment is ever needed. Special thanks today to Mayor Lee Harris and the Shelby County Board of Commissioners for approving the purchase of 90,000 COVID-19 testing kits to be distributed equitably across Shelby County in order to increase our testing capacity. And a reminder that everyone in Shelby County can now order 4 free testing kits online on the website COVID-testing.gov. And finally, before I turn it over to Chief McGowen, because we just celebrated the King Weekend, I wanted to share a quote that I believe fits this moment and sums up the past 2 years and lets us know that we are still in a collective responsibility moment. Dr. King said, "Moreover, I am cognizant of the interrelatedness of all communities and states. I cannot sit idly by in Atlanta and not be concerned about what happens in Birmingham. Injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. And I believe that we can all agree that right now, more than ever, we have been in a collective responsibility moment since the beginning of 2020. And now is the time, if you haven't already done so, to get vaccinated if you are eligible, not only to protect yourself, but to protect your family and to protect the community around you. Mask up, even if you don't like to do so, because it protects you and it protects everyone around you, and it ensures that we can continue to go on with our lives as a community. And finally, stay home if you are exhibiting symptoms, and test if you feel like you are having symptoms of COVID-19 so that you will know your status and you won't spread virus to others. And with that, I will turn it over to Chief McGowen.
Thank you, Dr. Taylor. I just have a few brief comments today to expand on some of the things Dr. Taylor talked about. First, we have some good news and bad news relative to our hospitalizations. The good news is that they appear to have plateaued. We're averaging 760 hospitalizations over the last 7 days. That's total of ICU and acute care. That number has not increased as we had forecast, so there is some good news that it is not increasing as forecast. The bad news is that it has plateaued at 760 people in the hospital who are COVID positive. That is a huge number of people. It's the highest number of people we've ever had hospitalized for the longest period of time. And so that is important because our hospitals are still feeling a significant amount of pressure, both on the acute care wards and on the ICU wards, and that is manifesting itself into the emergency departments. And so the first ask I have of you is, as we have said for the last few weeks, we ask you to get tested, but we ask that you not go to the hospital simply to get tested. They are still under an enormous amount of stress, and we can't afford people to add to that stress by showing up at a hospital emergency department for simply a COVID test. We ask you to manage mild symptoms at home. We ask you to get your test at one of the public testing centers or one of the private places that offers tests, like the pharmacies. And as Dr. Taylor said, very soon you should be able to have delivered to your home tests that you can take, and the Shelby County Health Department, Shelby County government are offering some of those tests. So number one, hospitalizations are very high. Please do not add to the problem. The second thing I'll add is that you have learned recently through the news that N95 masks or KN95 masks are critical to fighting the spread of this particular variant, and you will see many more people wearing those N95 masks. I want to address a rumor that is on social media today, and there is a rumor that government officials are going house to house, or people posing as government officials going house to house and offering to give you a free mask and to fit test. There's even a police bulletin that's posted on social media. I want to assure you that that did not come from anyone in Memphis or Shelby County. The Memphis Police Department, Shelby County Sheriff's Office did not issue a police bulletin about that behavior. There is some rumors that people are posing as government officials offering to fit tests and then, taking malicious action toward the people. That we have no information that would sustain that is actually happening in Memphis and Shelby County. So I just want to offer that today as a bit of information. But I will say, just as a note of caution, clearly, just as you would not accept something from a stranger who comes to your house where, hey, would you please, take this food and eat it, nor should you accept a free mask from somebody who comes to your house and offers to fit test it. So go to a place that you know to be reliable, whether it's your local pharmacy or the health department or another governmental entity that actually is issuing them forth. Should there be a drive like that, we will certainly tell you here first. So I just wanted to address that rumor that's kind of catching fire on the social media realm. Last, I'll just remind everybody, as Dr. Taylor said, we are blessed to have a significant amount of testing in this community, so we ask you to take advantage of that. We're blessed to have a wonderful opportunity for everybody to get immunized and boosted here, and we are not anywhere close to using our maximum capacity, so I encourage all of you. Many people now know people that have COVID, especially the Omicron variant, which is clear. Many people also know that people who have been vaccinated and boosted are not arriving at the hospitals. They are treating their mild symptoms. You might feel like, I think hell is the technical term when you have it, but you are not sick enough to have to go to the hospital if you have been vaccinated and boosted. So we encourage all of you to go forward and get those vaccinations and boosters. And with that, I will bring my comments to a close and take any questions.
Reminding all of our participants in queue to unmute themselves at this time. First up is Brasida Hogan from WMC.
Good afternoon. So I have like two in one question. The Germantown School District, I'm not sure if you guys have heard, but the Germantown School District has dropped the mask mandate. This was decided in last night's school board meeting. Members actually voted unanimously to move to highly recommending masks instead of requiring it. Can you kind of go over what the rules are when it comes to masks, and can school districts make these decisions on their own?
Hi, great question. The short answer is if the school district has any schools that are covered by the American Disabilities Act, there is a federal injunction that is still in place that upholds the mask requirement for those schools that is outlined in the Shelby County Health Department's health directive. So, in short, if any of the school districts have what we call ADA covered schools, then they should be requiring masks per the federal injunction.
Do you want to comment on this decision from this district?
I believe I commented by saying what the rules are, which is right now we are under a federal injunction in Shelby County that says that schools that are covered by the ADA are required to have masks.
Michaela Watts, Commercial Appeal. Michaela Watts, Commercial Appeal, you're up. Okay, I don't think we have Ms. Watts at this time, so we don't have any other questions at this point, so we may go ahead and go to final comments. And if any other questions come through, we'll put them through.
Great. So our final comments remain the same. You heard Chief McGowen say it. I will say it. We are definitely making progress in our fight against COVID-19, particularly with vaccinations and with testing to make sure that more people in our county know their status before they go about anything they're doing in their lives. But please remember that we are in this together. And that means that if you haven't been vaccinated or you haven't had the opportunity to complete your series or you haven't had the opportunity to get boosted, please do it. Do it this weekend. Do it next week, but do it as soon as possible. And then remember that our hospitals still have a high number of people in the hospital with COVID-19. They are doing their best to continue to provide the same quality health care that they always have. We are blessed with a great health system, but we want to do everything possible to alleviate some of the pressure on them so that they can continue to provide that quality care. And finally, if you're going to be out and about, remember, mask up. especially if you're going to be in indoor public spaces where you don't know the vaccination status or the illness status of the people around you. We still have a high level of infection in our community, even though the numbers are decreasing. And it behooves everyone to continue to protect yourself, not only for yourself, but for your family and for the community. And thank you for everything that you've done so far to contribute to Shelby County in a positive way and make sure that we're all protecting each other's health.
Okay, we'll try with that. Those are all of our questions. So we will wrap up for today and we will see you next week.